Okay, so have you ever like seen a car accident or
Yeah.
like even just, a fender bender?
Oh, yeah, definitely. I mean, who hasn't seen at least a little something, right?
It's crazy, right? Like so much going on and you just think about all the things those first responders have to worry about.
Oh, yeah, totally. I mean, it's got to be like sensory overload, right?
But one thing they always focus on, the spine.
Makes sense, right? I mean, it's pretty important.
So today we're going deep on exactly that, like uh how do EMTs keep that spine safe even before they move someone?
Yeah, the stuff you don't really think about.
Exactly. Like think about you hear those sirens and
Yeah. Just hope they know what they're doing.
exactly. So let's learn a little something today.
Sounds good to me.
So we've got this medical textbook excerpt, right? And it goes into all this stuff.
Oh, cool.
Yeah. So like imagine, right, a car crash scene, total chaos, and you've got a patient who's like semi-conscious.
Oh, wow.
What's the very first thing the EMT is going to focus on?
Well, like you said, it's got to be the spine, right?
Exactly. But why? Like why is it more important than like, I don't know, broken bones or
Well, think about it this way. The spinal cord is like this super delicate cable.
okay.
It carries all these vital signals from the brain to the rest of the body.
So like moving it around could
Oh, yeah. Any unnecessary movement could just like totally mess things up.
oh wow. Okay, so like that's why they
Exactly. That's why stabilizing that spine right away is like the absolute top priority.
so how do they actually do that? Like what's the first step?
So they do something called manual inline stabilization.
Manual inline stabilization.
Yeah. So basically, the EMT gets behind the patient's head, right, and gently cradles the head and neck.
So just like holding it still.
Yeah.
Yeah.
Keeping it perfectly aligned with the rest of the spine.
Wow. I mean, that sounds so delicate.
Oh, it is. They have to be so careful not to.
Like too much pressure or
Exactly. Or too little. They have to maintain this like neutral alignment.
neutral alignment.
Yeah, think of it like holding a bowl of water.
Okay, yeah.
You wouldn't want to like tilt it too far in any direction.
Yeah,
right?
I can no splashing.
Exactly. So the EMT uses this firm but gentle grip, one hand on each side of the head, and they interlock their fingers behind the patient's neck.
So it's like they're preventing.
Yeah, any twisting or bending.
Wow. Okay, so one EMT is holding the head perfectly still like that.
Yeah.
And then like what are the other EMTs doing?
Oh, so while that's happening, the other EMTs are like checking for other injuries.
Oh, right.
They got to do it all at the same time.
So it's not just one thing.
Oh, no, it's like this whole orchestrated dance.
That's crazy.
Yeah, so like while one's holding the head, the others are checking the ABCs.
The ADCs.
Yeah, airway, breathing, and circulation.
Okay, yeah.
So for the airway, they're making sure there's nothing blocking it, right?
Right.
And for breathing, they're listening for any sounds of distress, like wheezing or
Okay, yeah.
and making sure the chest is moving and all that.
Right.
And for circulation, they're checking the pulse, making sure there's no like major bleeding.
Wow, so they're doing all of this at the same time.
Oh, yeah. It's amazing how EMTs can multitask in these like crazy situations.
That's wild. I mean,
Yeah.
It makes you realize why they don't just like put a neck brace on right away.
Oh, yeah, exactly.
It's like way more complicated.
Totally. Like if you try to put a collar on or move the patient before that manual stabilization,
Yeah.
you could actually make the spinal injury way worse.
Like putting a cast on a broken arm before setting the bone.
Exactly. You got to make sure everything's lined up first.
Right. Okay, so we talk about why they do it, but like, can you give us an example of like a specific injury where this is super important?
Oh, yeah. So like a common injury in car crashes, especially rear end collisions,
Yeah.
is whiplash.
Oh, yeah. Whiplash.
That violent back and forth motion.
Right.
It can strain or even tear the ligaments in the neck.
Oh, wow.
And that can totally mess up the spinal cord.
Oh, no.
Yeah. And studies have shown that like doing that manual inline stabilization right away,
Right.
it drastically reduces the risk of making things worse.
So it's not just like a precaution.
Exactly. It's like the difference between a minor inconvenience and like long-term problem.
Wow. It really makes you appreciate all the stuff they have to know.
Oh, definitely.
Like it seems so simple, but
Oh, yeah. There's so much going on behind the scenes.
I mean, hearing those sirens, it's kind of comforting to know that they've got this whole system in place.
Right.
Like they're not just winging it.
Oh, yeah. Totally. They have protocols for everything.
Exactly.
But, and this is important, what we've talked about today, it's like
Mhm.
the simplest scenario.
Oh, right. Like in a real crash.
Exactly. Like think about debris everywhere or like crazy weather conditions
Okay.
or even multiple patients.
Oh, wow. Yeah.
That's when things get really tough.
So what did we learn today?
That manual inline stabilization,
Right.
it's super important.
Especially.
Any situation where there could be a spinal injury.
Exactly.
But I gotta ask,
Yeah.
we talked about those more challenging scenarios.
Right, like multiple patients.
Exactly. So think about it. How would the EMTs adapt in those situations?
That's a good question.
Right. I mean, it's amazing stuff.
Yeah, and I bet there's a lot more to learn about this stuff.
Oh, yeah, definitely.
Well, we'll have to save that for another deep dive.
Sounds good to me.
But in the meantime, maybe do a little research on your own.
Yeah,
Never hurts to be prepared.
absolutely.